You're listening to a podcast from the University of Manchester.
Well, what a time it's been. So all the staff and students at the university were sent home just a few days before the lockdown was announced in the UK. But I don't think any of us can be accused of taking it easy. In fact, many of our colleagues, researchers, students and alumni have been right at the heart of the battle against COVID-19. They've been helping frontline workers through both making and sourcing personal protective equipment, volunteering to help out with other tasks. They've been advising the government and modelling the pandemic in order to make informed decisions about the future. They've been keeping our energy networks running throughout the crisis so we don't have to worry about losing power on top of everything else. And they've been developing tests to identify COVID-19. So one fairly major project has been the mathematical modelling and monitoring of the virus spread. Dr. Ian Hall is basically becoming one of the most read names in the papers right now. He's all over the place. And he's been working on a new app that crunches the numbers from data submitted by users to build up an accurate heat map that shows where in the UK most people have reported symptoms of coronavirus and whether people are following social distancing guidelines. But that's not all, because Dr. Hall, along with Dr. Thomas House and Dr. Lorenzo Pellis and a team of PhDs and research assistants, are also looking back to historic pandemics like the bubonic plague for clues on infection patterns. So armed with this information and their own combined knowledge of healthcare and epidemiology, they're creating realistic models that can help predict how the COVID-19 situation will progress in the UK. This advice is then passed on to the UK's Scientific Pandemic Influenza Group on modelling, and they then report it to the Scientific Advisory Group for Emergencies, or SAGE. We'll be speaking to some of the researchers involved in this project a little bit later. And take a breath. If all that wasn't enough, researchers at the Manchester Institute of Biotechnology have been working on a test for COVID-19 that you can use at home. And best of all, it gives you a result in just 20 minutes. So it works using lateral flow, which to you and me means you wee on it, just like with a home pregnancy test. Then you wait, and then you get your result at home, so you don't have to send it off to a lab and then wait. So this could make a real difference for frontline workers who need to know if they have COVID-19 before they visit hospitals or go into care homes to treat people. But that's not all, and thankfully I'm sure everyone will be pleased to know I'm going to throw the baton over to you, Joe, because you've been finding out about how the university is helping to boost the UK supply of PPE.
I have, yes. So there's been lots going on across the Faculty of Science and Engineering to both make and source PPE. And what I think is great as well is that we've got academics, students and alumni all helping out. So I just thought I'd give some examples of what's going on across the faculty. So on the academic side of things, one great example is, and I hope I pronounce this right, is Dr. Obux Ijewomu, who is the Director of Commercial Project Management in FSC and is also a lecturer in project management in the Department of Mechanical, Aerospace and Civil Engineering, or MACE as we like to call it. So he has helped Manchester City Council to coordinate and test around 150,000 pieces of PPE so that they can be delivered to key workers around Manchester. So the council had received thousands of pieces of PPE from companies and from donations from people. But before the equipment could be distributed, it needed to be checked to make sure it was both suitable and safe to use. So Dr. Ijewomu has led a team of experts from, as well as the University of Manchester, people at the Universities of Coventry and Brighton, and has been able to organise video conferences, emails, physical testing and a wrap-up video conference all in under 8 days. They even worked over the Easter bank holiday weekend to make it happen. Another good example is that the university has been working alongside other universities, including Salford and Man-Met in Manchester, and they have been using 3D printing in order to repurpose specialised equipment to produce safety equipment for NHS workers, helping to reduce the demand across the city and the northwest. So they've been designing and making headbands for protective face masks, Professor Brian Darby of the Department of Materials has been coordinating our response, and he's been working alongside a team of experimental officers and various technical staff who have volunteered to help with the demand. They've been using around 50 printers across the university, and it's thought that around 500 additional mask headbands can be produced per week. The face shield that is used is being laser cut by commercial suppliers and assembled at Salford Royal. Now, on the student side of things, a great example is Olivia Faye Dickinson, who is a third-year Materials Science and Engineering with Textile Technology MN student in the Department of Materials, and she's returned home to her summer job back in Lichfield, where she works as a seamstress at an alteration shop. So she's been volunteering to sew scrubs for NHS staff in her local area, putting her skills to good use, alongside a group of seamstresses and cutters, and they've been donating their scrubs to a number of local hospitals. So we've also got alumni playing a big part, and one great example is Tom Macpherson-Pope, who is a computer science graduate. Now we're going to hear more from Tom in his interview in this podcast a bit later, but he's been 3D printing visors for NHS staff working on the front line. As you'll hear, Tom is a very enterprising graduate and has done loads of things since leaving the university, not least this work in helping the NHS.
Yeah, and we're going to be speaking to Tom later, along with a few of the people involved in the mathematical modelling project, and also someone else who has managed to resurrect several ventilators in one of Manchester's major hospitals. So we hope that you'll enjoy this podcast roundup of some of the efforts of the University of Manchester's colleagues. And first of all, we're going to be speaking with Dr Lorenzo Pellis, who, together with Dr Ian Hall and Dr Thomas House, has been crunching the numbers and using his expertise in mathematical monitoring to advise the government on its coronavirus strategy. Dr Pellis discussed the huge task with my colleague Dave.
In the moment of emergency, which was towards the middle of March, then we in our Manchester group we brought a really essential contribution in the early discussions that then resulted in the lockdown. This is work that has been done between us in Manchester, but with also a colleague of mine in Canada, in York University. She's called Francesca Scarabell, and then there are other colleagues in Oxford, and together we kind of realized that the epidemic is spreading faster than initial estimates from China would suggest. And it's unclear whether there are these differences. It could be due to a range of factors. But based on those estimates, there was this initial kind of initial idea, maybe, or initial views that things could be managed with maybe some aggressive forms of social distancing, but still it could be manageable without creating massive disruption to society. But then the infection moved to Europe, and we noticed that the numbers were growing fast in Italy and France. And the problem is that those numbers that you could see growing are numbers of confirmed cases, and confirmed cases are a data stream that is incredibly difficult to rely on, because it depends on the delay for the test result to come back. It depends on how quickly you are testing. So even if numbers are growing in any of these data streams, it could be due to other ad hoc explanations, to sampling biases, to an aggressive testing policy. So the fact that these numbers are growing doesn't necessarily mean that the epidemic is spreading particularly fast. It could be just that you are swabbing really fast. Then the fact that the deaths you see are growing also pretty fast might be due to the fact that there is a selection bias towards cases that maybe are more frail, particularly immunocompromised people, or older people that are more severely affected might die faster than average, and therefore this might result in the number of deaths growing faster than what you would naturally expect. But then we kind of realized pretty quickly that the numbers were growing fast in multiple data streams at the same time, in multiple countries at the same time, and for extended periods of time that were harder to explain from with ad hoc explanations on the sampling biases and other possible caveats that you could put on the data streams. And so that became evidence, quite strong evidence that things are that this infection is just really contagious, and these kind of work fed into a policy of lockdown, because if things could potentially be managed at the beginning, then once we realize that the infection is just spreading too fast, the risk of overwhelming the healthcare system is just so high that you are left with very little choice. And we are very aware that the lockdown is costly, both socially and economically, and obviously in the time of emergency, it's very difficult to quantify any of these costs. Even now, I would claim that the economic costs of a lockdown is just very difficult to calculate. So, but in the moment of emergency, the idea is that avoiding overrunning the NHS is the most helpful goal you can achieve at the moment, and the NHS coped incredibly well in kind of increasing capacity to account for that. So that was basically this analysis that showed that things are just growing too fast to be able to manage with other conventional measures was one of the important contributions we brought at the beginning.
To listen to that episode in full, head to the Buzz's blog page. We'll provide the link at the end of this episode. Doctors Pellis, Hall and House have not been alone in their mammoth mathematical task. They've been receiving help from some of the university's researchers and PhD students. I spoke to Bindu Vekaria and Jacob Curran-Sebastian about the role they're playing in this vital work. But first, I asked them to tell me about their own journeys through higher education. So Bindu, first of all, can you just tell us a little bit about yourself?
Sure. So I'm a third-year PhD student. I work across two departments mainly, so the Department of Mathematics and Health Sciences. So my research is about modelling and improving the accuracy of clinical prediction models. So these are tools that we use to basically predict the probability of something happening, an event of interest happening to an individual. So this could be a heart attack or, them developing some sort of a disease in the future.
And Jacob?
Hi, I'm Jacob. I'm a second year PhD student in the Department of Maths. And my main PhD is looking at the mathematical modelling of antibiotic resistance.
And did you both study for your degrees at the University of Manchester?
Yes. So I did the 4-year MMath degree.
Yep, I've been here for 4 years. So I did the BSc in the MMath at the University of Manchester and stayed on, still loving it.
Cool. Have you enjoyed your time here?
Yeah, it's been really good. It's a really lovely department, and in particular the epidemiology group that I'm in now is a really lovely group. So I'm very happy to still be here.
4 years of maths and still loving maths. That's incredible. That's great.
At this stage, it's more 7 years. 7 years of maths.
Wow. Who could have thought, though, that partway through your PhD, suddenly the whole world would change seemingly overnight as a result of the coronavirus? How has that change affected your work and your routine?
So I think, if anything, I'm a lot busier, and I think everyone that's in epidemiology will say the exact same. In terms of my work and routine, I'm working most days in the hospital, which is where I am currently, and it's kind of my main PhD project has taken something of a backseat to work on COVID. So yeah, it's definitely a busy time.
But unlike a lot of the rest of us, you haven't just been watching Netflix and eating out-of-date Easter eggs. You've actually been working on the front lines, mapping the possible projections of this illness. That's right, isn't it?
Yes, well, I'm certainly behind on Netflix, but yes. So the work that I'm doing in particular is based in the Manchester Foundation Trust hospitals, and we are looking at estimating lengths of stay for patients that come into the hospital, COVID patients. So what that means is we want to know how long are people staying in hospital for, and how long are they particular staying in an intensive care unit for. And this is something that's really useful for planners because they want to know how many people are going to be coming in, how long are they going to be here for, and that helps them to know how many beds they're going to need each day and what their capacity is. So I think it's something that's really useful for planning.
Bindu, can you tell us a little bit about the project that you've been working on at the moment?
Yes, so the main thing that we've been looking at is length of stay periods within the hospital, and because there are many hospitalisation pathways that an individual can take when they present with symptoms of COVID, and we don't quite understand how this. Well, what we're trying to do is understand how this impacts resources within hospitals, and one of the ways to do that is to look at bed occupancy, and we do that by trying to figure out length of stay of these different individuals who have these different pathways, to try and give a better understanding and to provide the hospital with a way of planning strategically for, maybe looking a week or two into the future, what they should expect in terms of cases, in terms of patients moving throughout the hospital, etc.
And are you seeing that information make a difference in the way that patients are admitted to and then travel through the hospital process?
We've been told that it's helped from a planning perspective, and how the hospital is sort of allocating resources, etc. Because they usually do this just by clinicians eyeballing numbers, which is a fantastic way to do it because they understand the dynamics of a hospital. But we're just hoping to make it slightly more data driven, and add some robustness to the way that things are usually done at the hospital.
So, not just helping hospitals as they battle a pandemic, but hopefully benefiting them in the long term too. It's pretty incredible to imagine your PhD taking you to the front line of a global pandemic. You can listen to that interview in full on the blog. Another Manchester colleague who's made a difference at the city's hospitals is Dr Andrew Weightman of the Department of Mechanical, Aerospace and Civil Engineering. I caught up with him to find out more.
I guess the challenge that was faced was focused on non-invasive ventilation machines, which are used in the hospital. And these devices deliver pressurised oxygen at high flow rates via a face mask and support patients who might otherwise need to be sedated and placed onto invasive ventilators, which are often kind of referred to as life support machines. The non-invasive ventilators, they use oxygen pressures and flows that are designed to have a controlled leak out of the vented face masks. But in this current crisis, this kind of creates two problems. The first is that it consumes a large volume of oxygen, so about 60 to 80 litres per minute. And this is a concern as kind of in hospitals, oxygen supplies are limited. And secondly, the high flow rates mean the treatment rooms are quickly filled with the airborne virus potentially, because it's an airborne virus and you're passing oxygen over people. So this would mean that the rooms would need to be sealed off. This would require lots of small rooms, and this would be very resource intensive in terms of nursing staff to support them and exposure risks for staff.
Yes, so a ventilator that leaks out COVID-19 infected air, I guess, is the absolute last thing you want anywhere, least of all the hospital. Yeah,
so the way the masks are designed with the holes in, so that would pass air over people's skin, and obviously that would then aerosolise the virus into the air, which would be a problem for people, really, a challenge. So the solution, kind of what we were looking to do, was to kind of rapidly design and implement a solution to this problem, and we came up with a bespoke adapter to fit the bottom of the face masks, which we generated using 3D printing, and this could kind of convert potentially life-saving systems for use with the sickest patients during the pandemic.
Dr. Weightman came up with a particularly valuable solution there, I'm sure you'll agree. Another area where 3D printing has come to the rescue during the pandemic is in the creation of personal protective equipment. I spoke to computer science alumnus Thomas Macpherson-Pope about his mission to create more PPE for frontline workers.
Yeah, so I've been 3D printing and laser cutting visors to help with the PPE situation for healthcare workers. So I've got about 5 3D printers, a couple of them from the lab, a couple that I already owned, and I've built another one since lockdown. And every so often I manage to get into the lab and laser cut the plastic sheeting needed for the visor, which is quite a quick process. And then it's just weeks and weeks of 3D printing to make the frame that holds those plastic sheets together.
How many of these pieces of headgear have you been able to produce so far?
Yeah, so I've made about 150 so far in terms of sort of total kits. So the way I'm producing them is putting them in a Ziploc bag, sort of disassembled, so that people can assemble them and make sure that it's in a clean environment. So I've been assembling them with masks and gloves and such. So I think in terms of complete kits, it's 150, and then maybe another 50 of various parts to then finish off.
And these have all been going straight to frontline workers who are looking after people with coronavirus.
Yeah, it's been quite interesting in terms of the distribution of things. So some people have contacted me directly, ambulance workers, GPs, but also people working in hospitals, on coronavirus wards, and people trying to help in the distribution. So when this started, I sort of felt helpless because I obviously can't help anyone in terms of a medical side of things, but luckily found I could 3D print. But I think everyone else has been sort of looking at how can they help as well. So there's been people helping in all areas of the project.
While Thomas had a helping hand with his PPE efforts, across the faculty, colleagues have been collaborating to make and collect PPE for frontline NHS workers. My colleague Dave spoke to Ubux Ishirumu about his role assisting Manchester City Council to coordinate and test thousands of pieces of PPE so that they could be delivered to key workers in the city.
I aligned with one M.F. Weiner, who wrote an article in the Journal of Medical Economics entitled, "Don't Waste a Crisis, Your Patients or Your Own." So in other words, when the crisis kicked in and I reflect and have conversation with colleagues, one of the things that kept coming to mind was that this is a time when researchers who are worth their salt will be struggling to make contributions to the pandemic and the crisis that is unfolding, which is a very fast-moving event. So I had that in my mind, and it was running. So when the opportunity came, I received an email from Manchester City Council suggesting that they had a problem that required help with. It immediately struck me that here is an opportunity to really to make the most of the crisis itself. And the email from the council read that they had received taken delivery of different batches of PPEs, and this particular batch had come from 4 different sources, and they were not certified. In other words, there was no evidence that they have been professionally certified for immediate use in the front line. And they were wondering what to do next, because it was a case of either they dispatched the PPEs as they had received them, or they withheld it and lived with the conscience of denying frontline workers the PPE that they could have used to protect themselves and keep the vulnerables safe. So faced with that challenge, I think they reached out to me and said if I could help with this problem. So it was quite interesting that everybody responded very positively, and I tried to ensure that the stakeholders understood the expectations of the project, the challenges itself, and what was feasible and what wasn't feasible. And in the end, we were able to gain access to 2 laboratories, and one in Manchester and one in Brighton. But because of the time duration, we went ahead with the Brighton laboratory, who helped to put some of the tests together, and collectively we analyzed the reports, and it was quite interesting to see the results that came out. In other words, the test involved having a control experiment. By control, I mean there was a certified mask that served as a control experiment, and the other 4 sets of masks, which came from 4 different batches, were now the experiment itself. So when we compared the pressure tests and other tests that we did on both samples, it was quite clear that the uncertified masks would have posed serious health risk to frontline workers. So it was quite interesting that based on that insight, the council were able to take a decision on the problem that they had at hand.
We really couldn't be prouder to be part of the amazing community that is the Faculty of Science and Engineering at the University of Manchester. That's all for this episode of The Buzz, but we'll be back soon with a brand new episode. For further information on what you've heard today, visit our website at manchester.ac.uk/thebuzz, where you'll also find links to the full versions of all the interviews we've featured today. If you have any questions about this episode, our email is fsemarketing@manchester.ac.uk. You can follow the faculty on Instagram and Twitter at UOMSciEng and search for our Facebook page and YouTube account. See you next time.